Super excited to be here today. It's our last day of the MAPS conference. It's always a bittersweet day because, all the doctors are excited to take this stuff back, but they hate leaving because they've networked and met so many wonderful other practitioners. And I'm here today with the president of MAPS, Dr. Daniel Rossignol, and one of our international fellows, Dr. Joseph Dib from Lebanon. So, Dr. Dib, can you tell us a little bit about what MAPS means to your country? Because we are seeing a lot of international doctors coming to MAPS, but I want to know what it means to you and your country.
Yes, I come from Lebanon, but I work in the Middle East. I practice in too many countries in the Middle East, and what I have seen that in my country and in my part of the world, doctors have no idea what is functional biomedical medicine, what is MAPS. I'm gonna tell every doctor who's listening to this that MAPS is the roadmap of changing lives with special needs. So in my part of the world is that when we have a child with special needs or autism, we go for therapies like occupational therapy, speech therapy, physical therapy, sensory, ABA, whatever. But I think that these children didn't learn with their families and their own setup, so they need something for the brains to function. If I want to give a therapy for a child who hasn't learned anything with his dad and mom, it's going to be so hard. So there's something blocking their brains from getting the information. So my advice is working biomedically as a MAPS doctor is going to change their lives for good. So I advise too many doctors to come from my part of the world for everywhere. This is a global problem. So let's work globally, let's network, let's argue, let's shake hands, put hands in hands. So I want that as much as doctors can come and learn in order to teach the parents what they have to do to give their children a better quality of life.
Thank you for saying that. I think what's important also to make note of, all three of us, you guys are fathers. I'm a mom of a child with special needs, and your emergency room medicine, family practice, you got into this because of what was going on with your families. And I think that's really critical because I think that the patients that come can see that you have gone through it, that and that you're giving hope. Can you tell me how you started out a little bit in this?
Yeah. Well, God gave my family 2 children with autism for a reason, and it's really to be able to help other people that are affected the way you are, and that's kind of what life is all about, right? It's helping other people who have the same issues, afflictions that you have as a family. And so having 2 children with autism is what drove me to look at the research, find what's out there, find treatments, because I was trying to get my kids better.
Right.
And then when I started treating other kids with autism, trying to get them better as well. And it's a journey, and we're always looking for more solutions. And so we have vested interest in this because we're trying to get not only our kids better, but other kids too.
Right, and I think that makes it, I think it makes a difference. Of course, there are wonderful physicians that don't have children affected, but I think that, this organization just gives hope. Like when we're told by mainstream medicine maybe that there aren't other things that we can do with our kids, we can find a group of physicians that don't know all the answers, but working together with researchers and physicians from other countries and learning from each other, you're going to take away, things that you may have not done with your children or your patients in a different database. So, I want to thank both of you guys for being a part of MAPS, for all that you do. So excited that MAPS will be coming to the Middle East. We want to push it. We want to help get as many doctors in your area trained because, like what you said earlier, we're really healing the world, right?
Yes, and I
this
promise
is a world.
It's going to happen.
And I promise you it's going to happen too.
It's going to happen.
It's going to happen. So thank you guys all for being here. Thank you.
Thanks.